Hi everyone, it's MissNikkiAnn. I am waiting for my 10-year-old to get his hair cut. And waiting in the car. I actually drove him. My mom has had knee replacement surgery, so she's usually like my driver. I wanted to make an update. Yesterday I went to the cancer center to get my iron infusion, which I had put off for months, I'm going to be honest. And then I had not taken my meds prior to leaving for the infusion, and I hadn't run my saline, or just I hadn't done anything the right way. So they took the pressure, was 140 something. The point is that wasn't high enough. I don't know what works for you guys, because everyone reacts differently to the numbers, and they're sensitive based on the different illnesses, and symptoms. We don't all have the same. So that is not a high enough number for me. So I went to, it was a long walk. I was in the room all the way on the other side, and I just didn't make it. And then, you already have the bracelet on at your fall risk, right? So no one wants to give you, how you doing, a chance to fall, obviously. That would make sense. And so it was a long day. That turned into, so they ran my saline, and they went and ordered all of the meds I was supposed to take before getting there. And finally my iron, which is the shortest portion, so something that could have taken me an hour and a half turned into hours. So yeah, and I felt really down, just because I hadn't finished the task, by myself. If you keep looking, oh my God. So I had driven myself because it's not too far. And, I always gauge before I leave, like if I'm capable of doing the task. And we all have your window. If you're not having a really bad flare, you're just in your regular POTS potsiness, or for me, just the pure autonomic failure. All of it makes a difference. It's not just the POTS, it's the combination of the things, and I have to tend to each different disorder or illness in order to be able to step out of the house, especially alone, which I haven't done in a long time. But my mom's knee replacement I keep trying to do what I can for myself first, and then ask if I need help. Well, yesterday, I needed help because I didn't do what I was supposed to do, and I felt bad, poor nurses. And the day before that, I went to see my GI. It was he wasn't in, and I missed the message because this particular hospital, they call you 50 million times, this machine, and she talks for like 2 minutes telling me what I already know. And so I saw them, I was like, oh my God, they're calling again. And come to find out, he wasn't going to be there, but there was someone else to fill in. People, I will never do that to myself again. I was there because I had my stimulator in the right butt cheek replaced, and my urogynecologist had emailed my GI, and the urogynecologist's office booked that appointment. I was only there to discuss the gastric stimulator. That was it. I was not, so this guy, so he's like my age or whatever, fast talker, fast, keyboard typing business. And, we're right, and most of us who've done this long enough and been frustrated long enough, we're right on it. We're just, rambling off everything, and we're ready to hit the ball when you throw it at us. But, I kept saying, I'm not here for any of that. So you want to talk about your liver disease? Right, because I'm overweight? Maybe you should ask me how I got to this point. Maybe because he's like, I read your file. You couldn't have read my file because that comment wouldn't have come out of your mouth because you would have a better understanding of where we are with it. That's not for you to tend to. I'm not here for that. Okay, I'm here about trying to get a consultation with a doctor who we could better, get some more information about the gastric pacer. I'm like, finally, I was like, and then all of a sudden he felt offended because he's like, well, he was saying that in the end he would be the person to do it in this particular area he's talking about, where he would, I know it sounds crazy, but it sounds crazy to me. I was like, he's like, so if you're talking to, I really don't think it's a good idea, but if you're going to be talking to somebody, it's going to be me anyhow, because I'm going to be taking over that position and such and such. I was like, oh, okay. So then I already have my real appointment, okay? Because I already have so he's like, so you want to, and well, he tried to push a new medication on me instead of Amatiza because, the nausea with I do not get nauseous from Amatiza, people. Like, that happened in the beginning, and I knew it was the Amatiza because it wasn't on much back then. I don't get nauseous from it. He should have looked at the amount of years. I kept saying, I've been doing this since 2004. Okay? Like I said, we've perfected my cocktail. Do not touch it. I do not want anything new as far as drugs are concerned. Well, obviously, you cannot perfect it if you're still having problems. It's a chronic illness. It's progressive. It's not going anywhere. Like, if a pill were a cure, I wouldn't be sitting here with you now. And I just don't want another pill. I want a consultation just a consultation, people. It's all me and my urogynecologist wanted. In the end, I told him no, thank you, that I would not take anyone whom he suggested. And then he's like, why? All of a sudden he felt offended. I'm like, no, I'm like, no, we'll not do it. I'll be going to someone independently, to you know what I'm trying to say, guys, for a second opinion. And I'll be seeing my regular GI anyhow. I love him. He's to the point. He doesn't have to try to insult me. He knows how I got to this weight. He watched it. We're all sensitive about it. But I wasn't there for that, though. I was there because my urologist booked that appointment to talk about seeking consultation for he and I both, because he's like, I'm willing to, venture out into that portion of it. And basically, I left there. I was so, I kept saying, guy, but you know what? When my urogynecologist put the stimulators in my butt cheeks, I said he had no idea what was going to happen. I said he didn't even know if it was going to work. He was like, but if there's even a 5% chance that it does work, do you want to go with that 5% and put the temporaries in at that time? I'm like, of course. Of course. So the temporaries worked. Now I have, the permanent. Something happened with the one on the right. No big deal. Took it out, gave body time to heal, put it back in. Now they're both singing and they're very happy together, the two stimulators. I prefer to know. If not enough, if we don't all try it out, who's gonna know? Who's gonna be the person to say what worked for them, what didn't? I know it's all 50-50, but guess what? The stimulator worked for me, and my body responded well. And I just want to find out more information about the stomach. That's all. So that's where I'm at, people. And then so that was, how many appointments this week? Was 3. I'm missing something. Don't want to talk about my liver disease. Do we want to talk about your obesity? Yeah, he's obese. When it was like he knew he was jabbing. He knew it once I had told him I wouldn't want any of his services. And if he had looked at the notes, okay, he had to have seen the notes. He didn't even know. I don't think he knew I had dysautonomia. He was saying anything to be sure that he trunked in the situation. Be the doctor knowing more info. I'm more concerned about patients telling their stories about did it work for me or not. That's what I want to hear. I want to hear from all of you like I've been hearing, and that got me here. I told him it's been a long road to get here, and I meant in two ways. The years trying to figure things out, I have to applaud myself and all the people who helped me. Okay, it had nothing to do with him. And then that day, driving myself there, feeling proud of myself. So I told him those two things. It took a lot to get here. So like, how dare you? I said, if there's something else that could possibly help me and it's not a drug, I want to try. And I told him it's a big deal to me. I'm 40 this year. I want to try. I want someone who's willing to find out. We're just trying to find out the information. I'm not saying we're doing anything. So, guys, that's just to say, we just keep pushing, and we keep listening to each other, and we keep trying things, and that's all you can do. And don't let someone convince you of something that if they can't tell you they're 99.9% sure, there's a chance. There's a small chance. And it worked for me with the stimulators. Very small chance, and it worked. And now we know more because a person like me and my urogynecologist were like, well, we're crazy enough to try. At least it's not another pill, people. He wanted to mess with my contact and get meds and give me a new cocktail of meds and give me something new. When I finally gotten to the point where I know how to live with this here cocktail, the ups and the downs of it, he's crazy. He's crazy. And it's a new drug. It's a new drug. You're not trying. That's not what I want to try anymore. I said, I've been doing that for 10 years. I don't want to try another medication. Stick with what it is that you want, guys. If there's one doctor who's not a quack, be sure he's not a quack, but there's one doctor who believes that, hey, looking at what I see here, you could be 5% chance. And if you want that 5%, go for it. And if all you want is a consultation, who should be offended by that? And my GI, who was sick that day, he's the one who mentioned it months ago. Okay? Yeah, he did. So what's wrong? But now that I know that guy might have been involved, God is good. I don't have anything to do with him. So I'm going to take it to a whole nother independent level, move it away from that particular hospital, those particular people. And it's sad. It's sad. And I'm pretty sure my GI won't be happy to hear the BS that went down. To know that he got an email and knew specifically what I was there about. And then I got sick while there. God help me. So, okay, that's it. People want to talk, I think. I don't know. Yeah, I keep seeing people I know walking. All right, guys. Believe in yourself. Believe in your doctors who are helpful. And admit that they don't know it all. And that all we can do is try. Same way we tried all those meds. We all have been there. You know how it is with POTS. There's so many issues with it that it's hard to control it with medications. So we just try, and there's nothing wrong with that. We shouldn't have to feel bad about it, because how will we ever learn if we don't try? Okay.